Hi, this is the Modern Dental Assisting, Chapter 51. We're only going over home care instructions for provisional coverage today. So these home care instructions for provisional or temporary coverage should always be provided both verbally and in writing. So your patient is going to be given these instructions, preferably before you do the provisional fabrication and after you do the provisional fabrication verbally, and then you give them these instructions in writing before they leave the office. With home care instructions, with a provisional, it is a temporary that is given to a patient or put onto a patient's tooth when they're waiting for the delivery of a permanent crown, bridge, or implant. So after these instructions are given, the patient will know not to bite or chew very hard on this provisional or temporary. They have to be careful on the side with provisional coverage. They need to avoid hard and sticky foods that can break or pull off the provisional. It's important that the provisional stays completely intact and in place for the duration that it should be worn, which is generally about 2 to 4 weeks. They should not neglect brushing and flossing the tooth with the temporary. When they do brush, don't brush vigorously. And when flossing, don't pop the floss out between the contacts. They should push the floss between the contact and then pull it out between the teeth. So if they're popping it in between the contact, that could loosen the provisional and cause it to come off. If it does come off for any reason, then they need to contact the office immediately to have it placed back on. They should keep the provisional, not throw it away. So keep it in their possession and bring it back into the office. If it is still in good functioning working order, they will re-cement the provisional in place and the patient will go about their day. If for some reason they do lose it or it is broken, they will create a new one in the office and then cement that in place. It's important that the provisional stays in place to protect the tooth from outside elements and so that the prep doesn't get broken. Also to protect the margins or the shoulders of the prep so that the crown, when the permanent comes in, it fits properly. So it's also going to help with sensitivity with the patient. Sometimes if the patient has not had a root canal, that tooth underneath the temporary can be very sensitive. So they will need that so that it will reduce or eliminate that sensitivity for them. Also for eating, speaking, and aesthetics. So the temporary serves a lot of different purposes, excuse me, and it's important that it does stay in place. So remind them that if it does come off, to contact the office immediately to have it replaced. So they want to avoid things like caramel, chewing gum, taffy, anything that's sticky and that can pull it off. So if your patients have any questions, make sure you answer them thoroughly and that you know the answer to those questions before you are answering them. If you don't know how to answer the question, tell them I will get the answer for you and go to someone in the office that you can get the answer to that question and then come back to your patient with that answer. So again, provisional and temporary are the same thing. It is not meant to be a permanent restoration. And patients do need to take precautions when they have that provisional on.